back in, everyone. I'm joined by Alana Graham, who is a respiratory care practitioner with St. Joseph's, or St. Joe's, as we call it, and Deanna Clark, who is a lead respiratory therapist. Thank you guys for joining us today.
Thank you. Thanks for having us.
So St. Joe's is having, they're highlighting Respiratory Care Week. So talk a little bit about why the system is taking a whole week to talk about breathing challenges.
Well, breathing is rudimentary to life.
Sure is.
And respiratory therapists, we span the whole field from the hospital stay to critical care to diagnostics, the pulmonary office, outpatient, and pulmonary rehab, my specialty.
How prevalent are breathing problems these days? Are they more prevalent, less prevalent, and why?
They're probably more prevalent as we have a larger aging population and more toxins in our environment, and yeah, we're pretty busy, and there's more treatments available, more knowledge getting out to the public.
Does it tend to originate when folks are young, you know, like a child, like when you're a kid, or can these develop at any point in life?
Well, as asthma, you get childhood asthma, and sometimes that's really hard to treat if the child has a respiratory virus on top of that. It comes into emergent care, and then the management of that. And then we have the older population, usually COPD, pulmonary fibrosis sometimes, and interstitial lung disease is a whole different treatment ballgame.
Talk a little bit about what makes St. Joe's team unique, because you know they talk about you guys are on the respiratory care team. So what makes respiratory treatment at St. Joe's a little unique?
In the hospital setting, we use our specialized clinical skills to evaluate patients and help them when they're at their most vulnerable state. We work to gain their trust and the trust of the healthcare team through compassion, empathy, and confidence. We recently, one of our respiratory therapists, CJ, was nominated for the Mother Mary Angela Award. We're very happy to have her as part of our team.
Yeah.
Yes.
You made that kind of it's kind of an obvious statement. You know, breathing is rudimentary to life. That's got to make the development of breathing challenges, especially as a kid, you know, pretty scary. So when you're dealing with the younger patients, how do you kind of take them in and let them know this is going to be okay? We're going to figure it out.
Take care of immediate needs at first, and then talk to the person and make sure what we can do to help them feel comfortable. Of course, the clinical skill set, but making the person feel comfortable and safe, calming them down is very important for their breathing, and just make sure they know that they're in good hands.
How can somebody learn more about this, whether it's just learning more about Respiratory Care Week or just this, you know, the services that St. Joe's provides, your team? You know, if folks want to know more about it, what should they do?
Well, anytime you go to St. Joe's, with a breathing issue, you're going to see amazing respiratory therapists. In the outpatient setting, you can talk to your doctors about specific clinical diagnostic care, or for pulmonary rehab, where we work on improving quality of life and reducing shortness of breath, you can ask for a referral from that. You can also check the St. Joe's website and social media. We have a Better Breathers Club peer support group that is open to the public for anybody with chronic respiratory issues. They'll post that regularly.
Better Breathers Club. I like the sound of that. Yeah. Everybody wants to breathe easy, quite literally.
Yeah. And that's open to the public.
All righty. Well, thank you so much for joining us. We really appreciate it. Thank you for the work that you do.
Thank you.
All right. Folks, stay with us. Your extended forecast is coming up.